Hello, I'm Darren Magee, and today's question asks if I would discuss post-traumatic stress disorder, commonly referred to as PTSD. Now, if you like this video, if you find it interesting or helpful, please consider subscribing to my channel. But just as a reminder, this video is not a substitute for support from a mental health professional, nor is it a tool to be used to diagnose someone. Now, following the First World War, many soldiers returned from combat experiencing what was then being referred to as shell shock. By the Second World War, it was being referred to as combat fatigue. Now, since the Vietnam War, it's been referred to as post-traumatic stress disorder. Now, that being said, it doesn't necessarily have to involve having been in combat. People can develop PTSD, having been in a natural disaster, having been in a terrible accident, being physically or sexually assaulted, or having been in an ongoing situation involving abuse or constant threat. There can be multiple events causing PTSD. Some people can experience PTSD not just from the things they've witnessed or experienced themselves, but from witnessing acts of extreme violence or life-threatening situations to others. Sometimes they experience due to the things that maybe they had to do themselves just to survive through that terrible ordeal, or perhaps they were unable to help or to save someone else in a terrible situation in spite of their best efforts. But in short, PTSD can be quite complex and multi-layered. But whether direct or indirect, it requires exposure to an upsetting traumatic event or events. So what is post-traumatic stress disorder? Well, post refers to after the situation. Traumatic stress refers to the emotional, the physical, and so on, response to the trauma or traumas. And disorder, meaning the impact it is having on a person's day-to-day functioning today. Now, even if that event was a few months ago, a year ago, 5, 10, 20 years ago, the impact it is still having today. So the thing about trauma is when something happens, now in spite of all those movies we watch, you see James Bond jumping out of burning helicopters and things like that, we are not really designed for that. We have a difficulty being able to integrate into our experience something that is just too horrific, something that is terrifying, something that doesn't sit well with us. Our brains don't like things that don't make sense, and we can ruminate excessively trying to work it out, or trying to get a new piece of information, or maybe push it away, try to avoid it. It's like the threat, the situation is still present and we don't want to think about it. Now, some of the common symptoms of PTSD include repeatedly reliving the ordeal through thoughts, memories of that trauma. This could include flashbacks, nightmares, even hallucinations. People with PTSD may feel a lot of distress whenever things remind them of the trauma, such as maybe the anniversary of the event. Now, when someone is reminded of the trauma, that would be referred to as a trigger. Now, what a trigger is, first of all, it's an external thing. It's a sensory thing. It's a sight, a sound, a touch, a smell, and so on. What is triggered is the emotional memory. When triggered, the person remembers exactly how it felt back at that time. There can be increased arousal, being in a state of hypervigilance, safety-seeking behaviours, being easily startled or jumpy. There's increased anxiety and depression. There can be a difficulty in connecting with others, being irritable or having angry outbursts. There can be disruption in sleep patterns. There can be difficult with concentration. Now, even just simple things like having a conversation with someone and having no idea what the other person has just said. There can be changes in cognitions and mood. Now, for example, if someone has perhaps experienced combat, they may now see the world as a dangerous place. So therefore, they're treating everything as a potential threat, a danger, a risk. If they've been abused, they may see everyone as potentially untrustworthy and having an ulterior motive, and treat everyone with caution. And as they try to protect themselves, for example, they may isolate themselves, they can become more withdrawn, find it difficult to interact with others, believe perhaps there is no future, they'll never get over this, or they may even engage in more and more risk-taking behaviours. But the symptoms and the severity can differ from person to person. Human beings, we are very complex, and as much as we all have similarities and commonalities rather, it's never really a one-size-fits-all. Now, normally in these videos, I would outline the Diagnostic and Statistical Manual, or DSM-5 as it's referred. I'd look at the criteria there, but in quite a few of the videos, people have been asking me to look more at the ICD-10, which is the International Classification of Diseases, which is maintained by the World Health Organization. So today we're going to be looking at the ICD-10 criteria for PTSD. So first of all, first criteria is the person has been exposed to a traumatic event or situation, either short or long lasting, of exceptionally threatening or catastrophic nature, which would be likely to cause pervasive distress in anyone. Now again, this could be experienced firsthand or could have happened to someone close to them. It could be witnessed. It could be a series of ongoing events such as intense bullying, neglect, abuse. It could come from perhaps being in a profession where someone is going to be exposed to a lot of trauma, such as being in the military or the fire service, ambulance, police service. Second criteria, experience persistent remembering or reliving the stressor in intrusive flashbacks, vivid memories, or recurring dreams, or experience distress when exposed to circumstances resembling or associated with the stressor. Now, these are not just memories, these are what are often referred to as intrusive thoughts around the event. The person experiencing these can often feel as if they are right back there in that moment. Or, as I sometimes put it, yesterday's situation, yesterday's threat is present today. And when reliving those events, many people with PTSD, they can feel anger, they may feel rage, helplessness, fear, terror. Sometimes they may even feel guilt or shame. The next criteria, exhibit an actual or preferred avoidance of circumstances resembling or associated with the stressor, which was not present before the exposure to the stressor. Now, people with PTSD may avoid situations, places, people that remind them of the traumatic event. The avoidance is a coping strategy. However, this coping strategy can often lead to more and more avoidance. For example, you imagine someone who's been in a difficult abusive relationship. Maybe when they first met, they had this song they both really liked. That was their song. Now, after coming out of that abusive relationship, that song is now a reminder. So that song perhaps comes on the radio, so the person changes the radio station. They don't want to hear the song because they don't want to be reminded. But after a while, it's no longer the song. It might be anything by that singer, by that artist, because that's going to remind them of the song. After a while, it might move on to pretty much anything from that genre of music. It's a way of constantly trying to avoid anything that's going to remind them of the traumatic event or remind them of the reminder. Next criteria, they experience either of the following: an inability to recall, either partially or completely, some important aspects of the period of exposure to the stressor. There's persistent symptoms of increased psychological sensitivity and arousal, which was not present before the stressor. And these are shown by any two of the following: a difficulty in falling or staying asleep, irritability or outbursts of anger, difficulty in concentrating, hypervigilance, and exaggerated startled responses. Now, someone with PTSD, there may be strong negative reactions to certain things. Things like loud noises, like a door slamming or a car backfiring, or to perhaps an accidental touch. Someone bumps into them accidentally in the corridor. The person with PTSD, it's like their fight or flight response gets triggered. It kicks in and they go straight into survival mode. Lastly, symptoms should manifest within 6 months, although in some cases there may be a delayed onset. And these symptoms, they can last, if untreated, these symptoms can last for years. Because treatment for PTSD can at times be difficult. Many people who have perhaps been victims of violence, sexual violence, abuse, they're reluctant to address what happened. Many learn to internalize it, keep trying to avoid even thinking about it. It's like, if I don't think about it, it's not there. The intrusive thoughts, the flashbacks, the nightmares, anything related to the trauma is just too distressing. And depending on the person, societal beliefs, perceptions, There can even be guilt or shame in even acknowledging what happened, never mind talking about what happened. There could be shame over how others may view them, or there could be feelings of guilt, again, not only for having been there, but perhaps what they had to do themselves just to survive it. There could even be guilt around, I survived this where others didn't. Also, and it's not uncommon that many people with PTSD may self-medicate. They may try to ease the distress, maybe numb the pain. So they may use alcohol, use drugs. They may use other things like excessive exercise or eating, or just generally isolating themselves. Another reason why it might be difficult to treat is because it can often be confused with, among other things, acute distress disorder, adjustment disorder, disinhibited social engagement disorder, reactive attachment disorder. Now, although these are all very similar, there are differences, and I'll maybe talk about those in future videos. But as difficult as treatment can be, it is possible there can be medication to help maybe take the edge off those intense feelings. There are different therapeutic approaches such as EMDR. Now that's eye movement, desensitization and reprocessing. There's trauma-focused CBT, there's group support work, there's the rewind technique. There's quite a few approaches to help treat it. What I also think is interesting is in the last few years there's been some research carried out in what's known as post-traumatic growth, looking at how a person has grown over the years in perhaps ways they didn't realize or have recognized, but maybe that's a video for another time. So that's a brief outline of post-traumatic stress disorder. There are many things I could add, maybe go a bit more in depth. But if you've anything you might like to add, if you've any comments, please by all means use the comment box below. There are some interesting conversations starting around these videos. But if you like this video, if you found it helpful or interesting, please consider subscribing to my channel for future updates on mental health related topics. And until next time, thanks for watching.